One of the biggest problems to overcome when prescribing psychiatric medications is folks stopping their medications when they have side effects. And yes, while side effects do suck, we need to know the importance of what type of different side effects do we need to be worried about. Because some side effects only occur when you start the medication or increase the dosage. Some side effects are dosage dependent and only get worse the higher you go. And some side effects are potentially health threatening or life threatening. So, we're going to discuss antidepressant class today of medications. So, the antidepressant classes, especially SNRIs, SSRIs, deal with serotonin. So, a lot of the initiation phase side effects include anything involving the gut, GI related, stomach upset, nausea, vomiting, constipation, diarrhea, all that kind of stuff. That tends to go away in about a week or so if you can kind of white knuckle through it. And it's not surprising since we have more serotonin receptors in our gut than we do in our brain. Now, if you get headache, dizziness, that sort of thing, again, those tend to be initiation phase problem side effects, and they also can happen when you increase the dose. But things like increase in blood pressure can be concerning. You need to talk to your doctor if you've noticed that. Things like impaired glucose metabolism and weight gain, and things like sexual dysfunction can all get worse the higher the dose that you go. Now, some glucose metabolism impairment and or weight gain can be mitigated or even negated by healthy diet, exercise, lifestyle changes, minimizing the amount of carbs, sugar, processed foods that you take in, but sometimes they can't. So you can speak with your doctor about alternative options. In terms of sexual side effects, some of that can be negated by other medications. Sometimes it can be negated by sexual enhancement medications like Viagra. In terms of the hairy, scary side effects, we're talking about things like serotonin syndrome. It tends to be fairly rare, but it's important to let your doctor know if you spike a fever for no reason, if your family, friends, or loved ones say that you're seeming to act confused, if you're having diarrhea for no reason, that sort of thing. That can be a life-threatening condition. It's really important to let your doctor know all of the medications that you're taking, because folks who take the triptan class of medication for migraines are at very high risk for serotonin syndrome. Outside of that, it's always important to talk to your doctor or provider anytime you're having a side effect, just to know what's going to go away, what may not go away, what can I tolerate living with versus what may actually be life threatening. As always, talk to your doctor or prescriber before you change your medications.